Hi, my name is Allison Sadowsky, and this is my presentation on the assessment of key components of curriculum. The term curriculum refers to the lessons and academic content taught in a school or a specific course or program. That is according to the Hidden Curriculum in 2014. There are many components of a curriculum that include vision or mission statements, to the philosophy statements that embraces the faculty beliefs and values about teaching and learning, and that is according to Keating in 2015. The curriculum that will be reviewed today will be that of the North Dakota State University System, or NDSU, with a focus on the nursing program. The following aspects of their curriculum will be reviewed today: the type of the accreditation of the facility, the mission, philosophy, organizing framework, program outcomes, end of program and level outcomes, and finally the implementation plan. The accreditation type for NDSU nursing program is that of the Commission of Collegiate Nursing Education, or the CCNE. As a voluntary self-regulated process, the CCNE accreditation supports and encourages continuing self-assessment by nursing programs and supports continuing growth and improvement of collegiate professional education and post-baccalaureate nurse residency programs. And that is according to the American Association of Colleges of Nursing in 2015. The re-accreditation process at the NDSU college or the NDSU nursing program will occur in 2015. The mission statement for the Department of Nursing is to provide a baccalaureate and graduate nursing education, to advance knowledge of the discipline, and demonstrate leadership in meeting the healthcare needs of a diverse society. The main elements in the mission statement are focused on education and knowledge, as well as the service to the community. The third element that is typically found in a mission statement, scholarship and research, is not represented in their mission statement very well. The mission statement of the institution itself as a whole is, with energy and momentum, North Dakota State University addresses the needs and aspirations of people in a changing world by building our land-grant foundation. This mission statement of the institution as a whole is a much broader level. It does not explicitly reflect on teaching or learning, service, or scholarship and research. It does, however, focus on the diverse and ever-changing society, which is similar to that of the nursing department. The philosophy for a curriculum should flow from the mission and vision statement. It gives the faculty the opportunity to discuss their beliefs, values, and attitudes about nursing, and an education that imparts a body of knowledge and skills for the generation of care providers. That is according to Keating in 2015. The main points within the nursing philosophy at North Dakota State University is that the faculty will treat each student as an individual. Also, that the faculty create an intellectually stimulating learning environment, and that they foster a mentoring relationship with the students. These main points focus on the program's beliefs and core values, which include autonomy, caring, integrity, justice, professionalism, and finally respect. These core values guide in scholarship of education, service, practice, and research. The philosophy of the institution as a whole differs as it focuses on different core values. The institution's core values include land grant, people, scholarship, teaching and learning, ethics, culture, and accountability. Some of these core values that lead to the philosophy are congruent, but some are at a much broader level. Now onto the organizing framework. The organizational framework serves to logically order the delivery of the body of knowledge in a curriculum and provides a checklist of sorts that ensures that no concepts are omitted. That's according to Keating in 2015. As stated previously, NDSU nursing program is accredited by the CCNE. NDSU follows a set of standards provided by them to ensure that their curriculum is organized in a logical order. Along with the CCNE guidelines, the core values provide a framework that support education for the practice of professional nursing as envisioned by the Department of Nursing. This framework is focused on the core values, much like the philosophy statement of the Department of Nursing. Now on to the program outcomes and goal. The nursing curriculum prepares professional nurses by providing a sound educational base for practice, graduate study, professional development, and professional and civic responsibility. This is the overall purpose statement, which is most definitely reflective upon the mission, vision, and philosophy of the Department of Nursing. This goal is encompassing of all the tracks of the nursing departments. They have also defined 5 specific areas that they focus on that are very well defined, which include clinical competence, critical thinking, communication, professional value, and leadership. These specific focus areas are defined in such a way that they can be measured at the end of the program for their success. Now on to the the student learning outcomes. There are 13 student learning outcomes that are identified by the Department of Nursing at NDSU. They are reflective of the mission and most definitely reflect the overall purpose statement of the nursing department. The outcomes are not labeled as to what level they should be accomplished, but they are defined as such. First, utilize the nursing process to provide nursing care for healthy, unhealthy, or potentially unhealthy human responses of individuals, families, groups, and communities. Second, to evaluate and utilize research findings, theories, and clinical practice guidelines in the performance of evidence-based practice. Third is to synthesize theoretical and empirical knowledge from the nursing behavioral, social, and natural sciences and the arts and humanities to provide professional nursing care at the entry level of practice. Fourth is to employ critical thinking for decision-making in clinical practice. The fifth is to collaborate with the healthcare team as well as individuals, families, groups, and communities to provide patient-centered care that promotes wellness, accelerates healing, and prevents disease in all stages of life. The sixth is model effective, interactive communication on the interprofessional team. The seventh is to use information and healthcare technologies to plan and provide patient-centered care. The eighth objective is to demonstrate responsibility and accountability for ongoing professional development. The ninth is to provide culturally competent and sensitive patient care. The 10th is to advocate for patients' rights through incorporation of professional values, ethical principles, and legal principles. The 11th is to manage nursing activities, utilize leadership skills in the delivery of comprehensive, evidence-based patient care with the respect of humanity and uniqueness of others. The 12th is to participate in the quality improvement of care, to enhance safe, quality, and cost-effective healthcare. And lastly is to demonstrate knowledge of nurses' role in shaping healthcare policy. And these are all according to North Dakota State University in 2015. These outcomes are listed in what I consider to be a logical with the application of the nursing process as they progress from synthesizing and knowledge. As they progress, they start to incorporate communication and cultural sensitivity. They end with quality improvement and the nurse's role in healthcare policy, which are the last of the NLN's core competencies of education. Next, onto the implementation plan. The curriculum is organized according to the conceptual model that flows from the mission and values of the nursing education, the essentials of the baccalaureate education, the standards of nursing practice, served as a guidelines for the development of the curriculum, and the content of the program increases in scope and complexity as the student progresses through the major. And again, that was found from the North Dakota State University in 2015. This track includes all prerequisites, objectives, and credits of the classes. There are not descriptions of the classes, just the titles of the classes or courses. And the curriculum map did not include the content outlines of each course. The copy of the curriculum plan that I received did not include documentation of its approval. However, I did sit on 2 of the curriculum meetings throughout this semester, and I'm certain that the process of the reapproval of the curriculum map is occurring as we speak. In summary, the curriculum components of the nursing department at the North Dakota State University are congruent with that of the faculty as a whole. However, they are much more specific in nature. The components of the curriculum flow in what I consider to be a very logical order. The overall goal is congruent with the mission, and it flows nicely with the core values that are established for the nursing program. The learning objectives of the program flow nicely, and they show progression throughout the program. The curriculum is laid out and portrays the relevance in our healthcare system today. It focuses on diversity in our society and the healthcare system overall. I would say that the curriculum of North Dakota State University Nursing Department is thorough in all the components and that it is logically and sequentially placed. Thank you very much for listening to my presentation, and here are my references.